shoulder is very superficial, means that, most of the structure you can feel pretty easily. So I actually start off, right over the AC joint, which is the end of the collarbone joint. Push on that over there. Now, you push hard enough, everybody's AC joint is going to hurt. But just kind of, push on both sides, see one side more than the other. I also push on the side of the shoulder, which is the, tuberosity on the shoulder. I also push along the clavicle in the front part of the shoulder if they have any injuries over there, for them. I also palpate the posterior joint line, which is kind of back of the shoulder. Posterior joint line, very classic for shoulder arthritis. Most people, when they have shoulder arthritis, you will hurt at the back of the shoulder. When you push on this area, this is where the joint is. Okay. For a rotator cuff tendon, they sometimes have pain on the side where the tuberosity is. That's the area on the side. You also palpate in the front part of the shoulder, right here, over here. When you roll your finger over your shoulder too, there's a little, almost like a rope there. That's your bicep tendon. And your bicep tendon is very sensitive. So when you push hard enough, it's going to be painful. So make sure you actually check both sides over there. That's the bicep tendon. You can pick up a lot of pathology over there. And one thing I want you guys to practice on yourself and also your partners maybe this afternoon and say, go a little bit medial to your bicep. There's a very bony structure that's called a core cord. So we actually, this is bicep here, where the, the little rope is. And medial to it, this is your core cord. Core cord's pretty sensitive over there. Right between the core cord and biceps is your subscapularis tendon. So when you have a subscapularis tendon tear, they will usually present a pain over the area. They will have some irritation in biceps tendon. We'll also talk about some of the tests we can actually diagnose some weakness on that also. So now, how do I test a rotator cuff tendon? So 4 rotator cuff tendons, right? What are they? Sits. That's actually my wife's last name, S-I-T-S. That's why I love this shoulder. So supraspinatus tendon, infraspinatus tendon, teres minor, which is, I don't know who that is, a stepchild of the infraspinatus tendon, and the subscapularis tendon, right? So knowing where they are, you can actually make your exam very easy. Supraspinatus tendon go from the top part of the shoulder, of the scapula, go to the top of rotator, top of the humerus head. So what does it do? It do abduction. Right? So you go down the top of the joint, you move, that will lift the arm over the side. So how I test supraspinatus tendon is actually with the patient abducted, we'll turn a little bit over here, well, abducted 90 degrees, and I'm going to push against it. So resisted abduction. You're stronger than that, Hallie. You're strong. I think the shoulder is a little bit torn over here. So, okay. So it's obviously, you can push hard on them. The other thing that I also want to focus is that, you remember how the angle of the supraspinatus tendon, it goes along the scapula, right? So don't do the examination on the arm all the way to the back or all the way to the front. You want to go along the scapular plane. So I want to kind of see whether, Derek catches over here. So when Hallie's turned sideways, it's not this far back. It's actually a little bit angled in the front. So go usually about 20, 30 degrees along the scapular plane and hold it real strong and push down on that, okay? And most people, you could really push on the shoulder hard over them, okay? That's for supraspinatus tendon testing over them, okay? For the infraspinatus tendon or teres minor, you bring your arm on the side over there, bend your elbow, and push out over the side over here for you, okay? That's the infraspinatus tendon or teres minor. Now, the reason why I call teres minor stepchild, because teres minor is very, very small tendon. Literally is about a quarter of what the subscapularis muscle is. It's actually in the same trajectory as the infraspinatus tendon. They rarely tear on its own. So I've been in practice about just a few years, 16 years actually. I've never seen an isolated teres minor rupture. Never, ever. It doesn't happen, okay? So, for physical examination over there, you kind of group them together. Infraspinatus tendon is at the back of the shoulder, teres minor in the back of the shoulder. So when the back of the shoulder, what happens when you rotate, you bring your arm on the side over there for you. So that's external rotation. That's actually resisted external rotation for you, okay? And then the other test I'm going to do is actually look at your subscapularis tendon. That's where I actually bring your arm across the chest over here. We'll bring your elbow up, and you push your hand down against the shoulder and actually resist them to lifting arm up. That's your subscapularis tendon. Slap tears over there, this is the last one I'm gonna end over here, Colin, is the one we look at the disease for the overhead athletes. We'll bring your arm across the chest with the thumb downs over there. I actually push against the shoulder. This is painful inside the shoulder. I rotate the arm the other side over there, less painful. So what are we doing? What are you really doing over there? Slap test is actually look for the disease of the biceps tendon as you go into the shoulder joint. So think about the bicep goes here into the top of the shoulder. When you bring your arm across the chest and internal rotating, you bring in the bicep into the line of the pull. So when you do this and you push, and then pain inside the shoulder joint, and you have less pain when you rotate the bicep out of the line of pull over there. When you have less pain here, more pain when you're internal rotation, that's a positive test. If you're pain in both position, not positive, equivocal for it. It's one of many tests we will look at for slab lesion over there, but this is called the O'Brien test over there for you.